The Minister of Health, Dr Joe Phaahla, has yet again urged the public to stay alert and maintain high levels of personal hygiene at all times to prevent the possible transmission of waterborne and foodborne diseases. This comes after a 24-year-old South African man who recently returned from Pakistan tested positive for cholera toxin, raising the number of imported cholera cases recorded this year to 3. The Department of Health has also confirmed that the total cholera cases recorded since February this year stands at 199, with 20 confirmed deaths after the country experienced a provincial and district cholera outbreak in Gauteng and the Free State. For more on the latest cholera case and where we stand with the fight against cholera, we are joined virtually by the Deputy Minister of Health, Dr Sibongiseni Dhlomo. Deputy Minister, thanks for joining us. It's good to have you on the programme.
Good morning, Leanne, and good morning to the SABC viewers.
Deputy Minister, I just want to get a bit of clarification on the numbers, because I'm reading so many different numbers online, different articles as to firstly the total positive cases that we've had in the country, and also the confirmed death number. I'm quoting 20, but I have a feeling it's a bit more than that. Can you perhaps update us on the total numbers at the moment?
Yes, Leanne, the total numbers of confirmed laboratory tests is 199. That number was correct. The number of deaths, taking the whole country, the ones that we had in Free State and also a large number in Hammanskraal, I think we're sitting at a number of 43. Yeah. Not 20.
Yeah, that's what I was thought. Thank you for the clarification. I was seeing higher numbers, but we had it as 20. So this is a devastating situation that the country has found itself in. So perhaps you can give us an update in terms of where we're at. Is it slowing down? Is it getting better from the health perspective?
Leanne, we have not had cholera in our country for a decade now, until February this year, when we had those 2 imported cases from Malawi. There is an endemicity of cholera in some of the neighboring countries, including them now we're picking up from Pakistan. So the actual bringing together of good water sanitation in some of areas has improved that significantly in our country. However, there may still be carriers, because the ones that we have in Hammanskraal is probably in the country, and it could have been myself or anybody who's a food handler or who probably has a cholera in his or her body, and probably was actually, because right now I'm hearing that the Water Research Commission will be releasing the results today, because to date we have not been able to pick up the source of the water. Yes, there were challenges with the water at the Rantswane, but they did not find any vibrio cholera in the samples that they have taken, which therefore presupposes, and it could have been myself who was handling the food, because we then ask and advise people on funerals to say, please make sure before you handle food, personal hygiene is very important, wash your hands, which is the same message that we give today. We are delighted that there's this one South African who came from Karachi, Pakistan, and all the people that he was in touch with have not really caught up this illness, because it is a communicable disease by touching hands. It's a waterborne. It's also foodborne, in case you have dirty hands from the bathroom and you touch or prepare food. Yeah. So we really are, like we are saying, the minister is really asking all of us to stay vigilant on issues of personal hygiene.
So, Deputy Minister, let me quiz you a little bit on, we still haven't found the source of what the problem was, but we were under the impression, and after a lot of looking at it, just if we look at the Hammanskraal situation, when we look at that Rooiwal wastewater treatment work, that has been identified, and I mean through water consumption. Is that not what the cause of, particularly in the Hammanskraal issues with regard to the amount of cases there?
In Hammanskraal, you do have a notice, including that was brought in by the mayor, saying, please do not use the water source from our taps, because we think our water is unsafe and unclean, and therefore they were giving them water tankers. However, the establishment has not revealed that the water being unsafe and for human consumption has got vibrio cholera. That part has not been identified. So it may be unclean, yes, not to use for any other challenges that they have, but the actual getting the bacteria of vibrio cholera in that unsafe and unclean water has not been the issue until we hear the report that is going to come in today. But that is what we have been informed as yet.
So there will be the report today, because it is worrying. I mean, Deputy Minister, when we sit here and we're talking to 43 deaths, and we actually still don't know the cause, and we don't know the source of it, and that is a great concern.
No, Leanne, we are actually asking me, you, and every South African to be really try and practice personal hygiene. This is what we have been advising, because we then trace it back to say it could have been the people in that funeral, in that household, who probably had food prepared by someone who did not. I could be having a vibrio cholera in my system, and I shared it all the time, and it's probably not causing any more problems with me to really cause me to go to the hospital. But if I do not wash my hands properly after being in the bathroom, that vibrio cholera, Leanne, can then be in the food, in the water, and can contaminate and have a spread to many other South Africans. So we are saying there may as well be some South Africans who remain with the vibrio cholera in their system, but it's not really causing everybody to get sick if you really practice personal hygiene. Indeed. So that's what is the message.
And we do understand that. I mean, that's something that we hope that, you know, the majority of people do practice. But that being said, there's no way that we can clear the issue around how bad our systems are with regard to water sanitation as well, because this has been fingered as one of the biggest issues, a sharp decline in the delivery of water and sanitation services. This has been red flagged for a very, very long time, particularly the issue around Hammanskraal, the water quality. This is years and years of this. So you can ask people to maintain good hygiene, but when you're using dirty and contaminated water to maintain the hygiene, what's the point? So I think there has to be a portion of that blame to the deterioration all around of service delivery in the country.
Yeah, but at the end, there has been a significant improvement countrywide from where we come from in terms of provision of water and safe and clean water. However, you are correct, there are still pockets of areas in our country where we would wish that all municipalities should take this as an eye-opener to say, let us really look and live up to our expectations of providing what legislation is expected of us. However, we then continue to say, Leanne, can we err on the side of saying, yes, my water is not clean as yet? Can we err on the side of boiling the water? Yes, if there is electricity or firewood, but also add the household jig in the meantime, while there's a process to really make sure that water provision in the country is safe and fit for human consumption for all our citizens.
Yeah. All right. Well, Deputy Minister, I'll leave it there. I'm not going to quiz you on the quality of our water. That's not really your role. But we'll wait and hopefully get more out of that briefing today from the Water Quality Control. So just very quickly, so yesterday, the Minister of Health announced another imported case of cholera. You mentioned it as well while you were chatting, a 24-year-old man testing positive after returning from Pakistan recently. He's been admitted, then later discharged from our KwaZulu-Natal hospital. Is there cause for any concern for people that may have come into contact with him? We know that I think the area that he visited is now one that has been confirmed in Pakistan as a cholera outbreak area. So perhaps you can help people, if they are in contact with people who've had cholera, should they be concerned?
Yes, thank you, William. Firstly, we are reporting this case so that there is no such stuff that can probably works in the laboratory. Say, but why is the department quiet about this matter? We need to actually tell our citizens. Number two, the family members, 4 of his family members have been traced through our outbreak teams and also been checked, and they have no signs of having the symptoms of the vibrio cholera, but we keep following up. So we are actually saying, yeah, that is a very commendable way of looking after yourself in case you may, because in the plane that he was traveling with, it's unlike COVID. We are not likely to go to the plane and check who was sitting next to the person, because it is not spread through airborne. But there's another friend who was staying with in Karachi, has been traced and looked after and is not having a vibrio cholera, and the family here in South Africa has been traced. So we are just alerting and commending that it's a good way to be able to trace back, and those surrounding you, even if you are affected, should not get an infection from you because you do have cholera at the time.
Deputy Minister, just we have to close the interview now, but there was a story that, of course, yesterday was in the courts. I know that the Pretoria High Court has reserved judgment in this. I'm not sure if you would comment on this particular case that's currently there, and I imagine I already know the answer beforehand, but the Health Justice Initiative is appealing against government's refusal to make several documents relating to the procurement of COVID-19 vaccines public. Is there any comment from the Health Department with regard to this case?
You are correct, Leanne, when you said you do have an answer before I answer. No, this is predating my time. I'm still understanding how it came about, so I will not be able to assist you on this one, Leanne. I'm sorry.
Not a problem. Deputy Minister, just trying my luck, seeing if perhaps you would like to comment on it, but nonetheless, we'll keep an eye on this one. We do know, we did chat to them yesterday, and the court has reserved judgment, so we'll certainly wait and see what goes on with this particular one. But in the meantime, Deputy Minister, thanks for talking to us about this latest incident with cholera. It's an imported cholera case that's been identified in KwaZulu-Natal, and that, of course, our Deputy Minister of Health, Dr Sibongiseni Dhlomo, talking to us about that one, and also saying that there will be an update this afternoon from Water Quality Control about where they are with regard to the water situation in the country, and that, of course, being one of the fingered causes of cholera in that outbreak where we saw 43 people lose their lives to it.